And there was a lot of, we did a lot of refinements in the last 2 years, including House Bill 1104, which we spent a lot of time on.
Thank you, Chairman. I'm Representative Mindi Mesmer, or what, former Representative, I get used to saying that. Former Representative Mindi Mesmer, representing formerly Rep. Rye and Newcastle. I am an environmental scientist for 30 years, and I have a master's degree in public health recently as well. I've been involved with the Merrimack situation for several years. I was asked to come help the residents of Merrimack. I was actively involved with some issues, the same issues on the seacoast, and it seemed that there was a disparity between what kind of response was happening on the seacoast versus Merrimack, and I agree there was a big disparity and they did need help, and I have been actively working with residents there to try to raise awareness about this and also find solutions for the people that are impacted. As Representative Murphy said, the state of the DES now admits up to 65 square miles may be impacted by air emissions released from the plant. Saint-Gobain is a Fortune 500 company. They last year had $1.785 billion in profit. They certainly have a lot of money, and that I think they have been actively thwarting efforts to restrict legislation on PFAS chemicals as well as other things in the state. So the HB737 bill did pass last year. The portion of it that the DES representative is talking about, the air emissions bill, did come from the state, from the DES, but the other part of it was the water bill that came from myself, actually. So luckily we got it passed. I come to you because I'm extremely concerned about the children in the area, as well as the adults. I know that there are some adult onset cases of rare forms of cancer that we have as well in the seacoast area. And I think the commission is needed to get all the stakeholders to the table to see what's going on, to make sure we make some progress. There's an environmental risk from the water contamination as well as a health risk that's not at all been fully evaluated. About 200 people were randomly selected for blood testing in the Merrimack area versus 3,000 that were exposed at Pease that were allowed for blood testing, and that system was closed down, and that's a whole other issue. But it has not been adequately addressed whatsoever, the health impacts related to exposure. I was looking last night also at, we now know there's a lot of emerging information about the impacts to children from both prenatal exposure and early childhood life. And these cause outcomes like impaired responses to immunity and vaccine response, as well as some other things like late onset of puberty. Actually has been shown to cause reduced sperm counts and other malformations of gender, which I won't go into specifically, but those are very concerning. But it also causes autism, ADHD, and other behavioral issues. And I looked last night at the Department of Education statistics for our state, and Merrimack has one of the highest special education costs per county than anywhere else in the state. So this is a very big issue for the state of New Hampshire, for the people of Merrimack, and I think we need to get all the stakeholders, DES, DHHS, to the table. I've asked several times for health evaluations, cancer evaluations from the DHHS, and I think it's not to date been adequately done whatsoever. So I would encourage this committee to pass this legislation. It's really important to get all the stakeholders to the table, come up with ways to come for solutions, and to figure out the best way to handle it. Thank you very much.
Thank you. Any questions? Seeing none?
Thank you so much.